Mehran's classification. So Mehran's classification is defined as into four types. That is 1, 2, 3, and 4. So this is nothing but is called as the Mehran's classification. So Mehran has defined it into, suppose there is stenosis that is within less than 10 millimeters within the stent. So within stent, if there is less than 10 millimeter of stenosis, it is called as grade 1. Type grade 2 is more than 10 millimeters, but everything is within the stent only. There is no stenosis outside of the stent. And suppose grade 3 is defined as if it is more than 10 mm and it is outside the stent as well. Then it is called as grade 3, and grade 4 is nothing but it is total occlusive. That means the stenosis has completely occluded the vessel. It's called as grade 4. So you can see it is either focal, that is less than 10 millimeters. Diffuse is more than 10 millimeters, but you can see is that grade 2, that is within the stent only. Proliferative is some part has gone outside of the stent, but there is not occlusive. And grade 4 is total occlusion of this. There are some other classification as well. So this Mehran classification is basically based on angiography wise. We have few thing called as OCT based also. The ISR is defined into three types. One is called as homogeneous, where you can see there is a uniform stenosis you can see in this part. And this is called as the heterogeneous part. That you can see is that some part there is no uniformity, different types of stenosis is there. And they suppose the stenosis is in two layers, that is some part of atherosclerosis and other parts of neointimal hyperplasia, then it is called as layered type. And coming to etiological wise, ISR is defined into type 1, that is mechanical. That means that mechanicals mean nothing but it is either because related to the stent. So it could be because of a stent fracture. Suppose a fracture of the stent has occurred at any place, their stenosis can start. Or suppose the stent was deployed, but it has not expanded. As you can see here in this picture, the stent has to, if you open that, this stent has to completely get opposed to this wall. Here you can see that there is under expansion. The stenoblast is not yet openly expanded. So there is under expansion of that part, which can lead to ISR. So this is called as type 1 mechanical cause, which is an important cause of ISR. Second is the biological causes, which means there could be either neointimal hyperplasia or there could be neoatherosclerosis. So neointimal hyperplasia means nothing but when there is increase in smooth muscle cell proliferation. Muscle cell proliferation. If you see that, then it is called as the neointimal hyperplasia. It is usually seen little early, that is within actually around, usually said that it is 6 to 12 months of period. You usually see that. And neoatherosclerosis is like a normal atherosclerosis, which but it has formed within the stent. So it will contain all the lipid core macrophages and plaque, everything will be there in this pattern. So it's called neoatherosclerosis. It is certainly a delayed presentation, usually seen more than 12 months of stent deployment. Other types is the mixed pattern where patient can have both neoatherosclerosis and neointimal hyperplasia, both can be there. Patient can have complete CTO because of the ISR, and patient can have multi-layer. That means suppose a patient had a single stent, now one more stent was deployed due to ISR or stent thrombosis, and within those layers, if it keeps forming the stent stenosis, is called as multi-layer stent restenosis. This can also be placed at any part where there is overlapping of stents. Suppose we have kept two stents and two stents are overlapping and you formed stenosis in the multiple layer here as well and the second stent as well. Then it is called as type 5 or multi-layer one.